Welcome to our continuing 2020 educational webinar series. I'm Katherine Short, Partnership Marketing Manager for First Healthcare Compliance. At First Healthcare Compliance, we help you with a comprehensive compliance management solution tailored to your business. A hospital, hospital network, healthcare practice of any size, billing company, or skilled nursing facility. As part of our complimentary educational webinar series, we bring you experts from around the country to discuss relevant topics in the healthcare industry. We are so pleased to have Andrea Tinianow, Esquire, Chief Legal and Compliance Officer, and Thomas R. Allen Jr., Director, Healthcare of Transparency Registry with us today. Transparency Registry offers the only cloud-based registry that securely tracks distressed consumer debt from the time it is charged off to the time it is closed, tracking all changes in the debt's owner, servicer, and balance. In 2014, the Markel administration recruited Andrea to launch the Division of Corporate and International Development for the state of Delaware. The following year, she founded the Delaware Blockchain Initiative, the first of its kind blockchain endeavor designed to deploy blockchain technology in government and enact blockchain-friendly legislation. Andrea is on the advisory board of the Wall Street Blockchain Alliance and the founding chairperson of its Enterprise Solutions Working Group. She's a frequent contributor to Forbes.com, writing on subjects pertaining to the world of blockchain technology. Markets Media awarded Andrea its Women in Finance Award for Excellence in Blockchain. Forbes and KPMG selected Andrea for its Great Rewrite video series. Andrea received her undergraduate degree in economics from Brown University. She attended Delaware Law School, graduating magna cum laude. She clerked for former Chancellor William Chandler III of the Court of Chancery, and then joined Pepper Hamilton representing clients in litigation. Following her stint as a litigator, Andrea joined CSC Corporation Service Company as its Assistant General Counsel. Soon after, she was promoted to the newly created position of Vice President, Business Development. Thomas R. Allen Jr. is a healthcare executive specializing in medical practice growth. Allen has a record of improving efficiencies, quality, and safety and forging partnerships that strengthen all entities, cost containment, and operations. Allen started his healthcare career as a board-certified dosimetrist specializing in treatment planning in radiation oncology. To build the practice, he differentiated it through the installation of the most advanced technology in the market and designed and mounted a marketing promotion highlighting the new resources and the academic achievements of the users. In 8 years, Allen transformed the practice from one location with 13 staff and generating 1.2 million to 25 locations with 300 staff and 60 providers caring for 50,000 patients and generating 150 million in annual revenue. Allen decided to leverage his success and became an operations consultant. In this role, he oversaw business and clinical operations, infrastructure, policy, clinical development, and financial reporting. Under his guidance, by devising business plans and enhancing service offerings in medical oncology, surgical service, genetic programs, and pharmacy, the firm experienced a 400% surge in revenue and 133% plus client base growth achieved within 12 months. Allen was also responsible for conceptualizing a startup that developed software to escalate revenue cycle management process. He authored the software process based on CMS billing and coding guidelines. 20 million in transactions was accomplished in 12 months by forming an alliance with a global software company to create an artificial intelligence product service. Allen holds a master's in medical dosimetry from Baptist University of Tennessee and is a graduate of Harvard's Medical School's Safety, Quality, Informatics, and Leadership program. A copy of the slides is available for download on the control panel. Feel free to submit questions in the question box of your control panel during the presentation. We will address questions at the conclusion of the presentation. Your PACOM and PMI CEU certificates will be emailed to you following the broadcast. Your PAYCOM certificate will come directly from PAYCOM, and your PMI certificate will come from our email. There is no need to request either one. Additional CEU opportunities will be available to BC Advantage members following the live broadcast. See their website for details. A download of the handout is available on the side panel of your screen. So Andrea, Thomas, welcome. Thank you so much for being here today.
Thank you, Catherine. It's really a pleasure to be here, and we're so happy to have this opportunity to speak with you and speak with your listeners here today. As you know, the title of this presentation is Medical Debt, the Good, the Bad, and the Ugly. And for a while, I really was unsure whether we should give this presentation at this time, because it seems to talk about medical debt. In some ways, it seems that it's so unfeeling, right? We're now recording during the time of the pandemic. We're all hunkered down. I'm in my third floor office. I know you, Catherine, you're in your home, and Tom is in his home. And if this were a normal day, a regular day, we would probably be all together doing this and sharing conversations easily during this presentation. But that's simply not the case. COVID-19 and the threat of this awful illness has really changed the world for all of us. So this is the time of the pandemic. We are hunkered down. The economy is closed, and we're all experiencing this together. And it's interesting, Catherine, when I said, well, maybe we shouldn't be doing this, and you said, no, actually, this is an important topic. This is something that people will be caring about. And frankly, during this time, it may even be more important for hospitals and health systems and doctors to really understand what their options are with medical debt and what they can be doing about it. So in this presentation today, we'll be looking at medical debt. What are the issues, the opportunities, the challenges, and solutions, potential solutions. So like I said, it's hard to really start talking about medical debt without considering where we are in the context for this presentation. I am married to a doctor. I have doctors in my family. They work in hospitals, so I know firsthand, or not firsthand, but really secondhand, that there are many doctors and hospitals and health systems who are now on the front line of treating patients who have COVID-19, and this is really a very, very difficult time for them. At the same time that they're giving so much for all of us, for our community, there are doctors whose practices have been sidelined. They've had to close their office because they're unable to treat patients, ophthalmologists, dermatologists, and several others, so many other specialties are unable to treat patients, either because it's not considered essential services. They're only seeing patients who are in distress or emergency situations. And so many doctors are sidelined. They have a loss of income. They've had to close their offices. And so what we have here is really a perfect storm of patients in the most dire situations. And then you have health systems and doctors' offices that are losing revenue, medical practices losing revenue because they're not able to do the elective surgeries and other services that can bring in revenue to the office. So at the very time when we need our health systems to be operating at full function and being productive and profitable, they're not able to make some of that profit they need to keep the hospitals going. So we hear about doctors being laid off. So the question of getting paid becomes even more important, right? Especially when there are projections of loss. So that brings us to debt. And we go into our first slide. Let's see if I can make that happen. Okay. Let's see. I'm sorry, Catherine. I'm having trouble. I thought I was pressing the right button, and now I'm not pressing it. It's not working. Okay, let's try. Let's see if I can make this. Okay. So that brings us to our first slide. about debt. There's quite a lot of debt in this country, and it's almost hard to escape the the crush of debt that overwhelms so many of our friends and neighbors. And you can see by the slide that there's quite a bit of debt, and once a consumer is in debt, that debt can continue for years and years. But when we think about medical debt, and as I was talking about this, the debt that currently exists, there will be more debt to come. But when we think about debt and the idea that you have so many patients in debt, nearly 1 in 6 Americans were contacted by a debt collector because of a health bill. 52% of the items on credit reports are for medical debts, and there are statistics that say that half the debt in America is actually medical debt. When we think about medical debt, it's really hard to lump medical debt in with the other debt out there, with credit card payments, car payments, and other types of loans, because medical debt is really in a class by itself. And some people might disagree. Of course, everybody wants to get paid, but when you think about how medical debt is incurred and the creditor, the hospital, the doctors, the medical systems, when you think about that, and you think about what is their goal, your goal, what is your the reason for providing the services, it's to keep your patients healthy. And so many health systems now aren't just treating the patient, they're in the community. And there's a holistic approach to ensuring that the patient has everything he or she needs to stay healthy. So when you think about that hospitals and doctors and health systems are trying to ensure the medical, the body, the health, the mental well-being of their patients, and then you think of the question of how hospitals and health systems, get paid. It becomes very tricky. There's a balance, because on the one hand you have health systems that they want to collect what's owed to them for the services provided, but on the other hand they don't want to undermine their good work, because they want to collect on that money, but they don't want to do so and in the process create duress and cause additional harm. So it can be tricky, and frankly, hospitals and doctors and medical systems who are seeking to find an answer how to make that happen, how to bring in the money that's owed to them, there's very little guidance, very little guidance about collecting on medical debt. If you were to go online and do searches about medical debt or debt collection, first of all, there wouldn't be a lot out there, and most of the resources you would find would focus on outliers, would focus on aggressive hospitals that are going after the Goliath, the David and Goliath scenarios. The focus is on the big bad hospital or the big bad debt collector and the patient, and who has no means to pay. And frankly, in these articles, you'll find patients who racked up really high bills. Maybe it was a spouse that was sick or perhaps died, and the partner has been left with the bills, and then or someone who has undergone treatment, had the most severe illnesses, and then they have their wages garnished without any warning. And if you go online, these are the kind of pictures you're going to see. And I suspect these are, like I said, these are outliers. This is not what no hospital wants to be or health system wants to be in the news for overly aggressive tactics, even if they are within the bounds of the law. I suspect that this type of sensational reporting is not good for anybody. It's no hospital, no debt collector wants to be painted as a villain. And frankly, individuals, patients, they want to do the right thing, but they are overwhelmed by the debt and the inability to pay. Maybe they had health insurance, but they had a high deductible, or maybe the medical provider was out, was it was an emergency, or it was a situation where they were being provided by an out-of-network provider, and the expense was extremely high. And our health, our health system is we have a very complicated health system, and although people are trying to fix it in government, it's still a problem. But we're left, and the fact is that hospitals need to get paid, and medical systems need to get paid, but it's a delicate balance, frankly. So the question is, how to do the right thing, because, as I said, I believe doctors and hospitals, they do want to do the right thing. So now I move to the next slide, and so in this situation with the pandemic, with the uncertain economy, with now COVID-19 related medical expenses, and the loss of health insurance by many individuals, and businesses shuttering, the question is, what to do. I mean, right now we have 36% of all crowdfunding goes to medical debt. And frankly, if a hospital is collecting 12% there, and this professional debt, using professional debt collectors, they're doing well. Generally, after 90 days, a hospital places its debt with a collection agency for some of them. But is this really? We need to figure out what is the best approach for hospitals and medical systems. What are their options? And frankly, many hospitals and medical systems, especially smaller organizations, they have their employees. They seek to collect debt, or the other options might be to hire a third-party debt collector. Still others, very few, will sell their debt to third-party purchasers, and still others may write off the debt entirely. So each of these options have their own advantages and their own disadvantages, and we will go through, let's say, all three of those options here. But at this point, Tom, you've been awfully quiet, and I know you have a lot to share. So what I would like to do is ask you some questions about your background, because as we learned from our introduction, you built a 60-physician multi-specialty practice in Western New York, and that was oncology, radiation, surgical oncology, OBGYN, primary care. You had in-house physician dispensing. You did this for about 8 years, and I think you said in the last year, you told me you took in 150 of annual revenue. Is that right?
Yeah, that is correct.
And tell me, what kind of medical debt, let's say, that you had in the last year of your practice?
Yeah, if you don't mind, I just want to kind of just add a couple things you said.
Yeah, sure, please.
I completely agree, and I think anyone in the healthcare space agrees with you that medical debt is surging and has been surging. But I'll just talk briefly about what we're seeing, not just locally in Western New York area, but nationally, through colleagues that I converse with on a regular basis, that we saw a pretty steep peak in rise in medical debt around 2010, right around the passing of the Affordable Care Act, because that led to significant expansion that you already touched upon of the high deductible plans. So with the increase in high deductible plans, you have a decrease in premium, but it leaves the patient with larger out-of-pocket expenses before your insurance kicks in. And unfortunately, every year, even these lower premiums are increasing at a national rate of anywhere from 3 to 5%, and the maximal allowable patient out-of-pocket expense is increasing as well. So basically leaving more patient responsibility and less insurance company responsibility, which to me, which I'm seeing, on our financial, books and records, is increased patient debt. And it leaves us as healthcare professionals, whether, from the administrator to the physician to the whole healthcare system, is what do we do with that debt? Because here we look at ourselves as we have true relationships, with our patients, and it's almost an
So,
ugly,
so
ugly
Tom,
area.
so
Yeah.
Tom, when you say we have true relationships with our patients, I mean that reinforces the idea that medical debt really is very different from other types of debt and needs to be treated differently. Would you agree with that?
Yeah, absolutely. It needs some care, compassion around it.
Right. And so what you were also saying this idea that you could have individuals who have, I mean, sometimes you think about folks who don't have health insurance as they're the ones who are in the medical debt, have the most debt. But it sounds like what you're saying is that you have people who have insurance, but they're underinsured or they just don't make enough to cover the gaps that exist in the current insurance plans because of the deductibles. And also you have the out of networks, the surprise out of network expenses, correct?
That's absolutely correct. And like I said, the increase of high deductible plans, I would say, is the first and foremost from my experience. And we have in the cost of doing medicine is increasing, increases every year. We have new therapeutic agents. We have new diagnostic testing. And the insurance companies, unfortunately, are pretty late to the game on coming up with an appropriate fee schedule based on new CPT codes, billing codes. And that leaves the patient with the difference in the balance. And the physicians and healthcare systems, they're investing in these new therapeutic agents, the new technologies, so they have higher costs and they tend to be recouping less due to the high distress medical debt.
And so that makes it even harder for the hospitals and the medical systems to continue to provide the excellent care that they want to provide, to have enough doctors on staff, to have enough medical staff available to really do the kind of care that they've been investing in.
Yes, yes. And I'll just add one more thing to that, and I'll let you
Please.
go back into. I think we have about hospitals in our nation have about a 2.1% margin, operational margin, and patient responsibility of medical debt equates to about 3 to 4% of operating revenue.
So you're saying out of the revenue coming in owed to the hospital, 3 to 4% is medical debt that they can't collect. Is that?
I can't. I'm not going to say that they can't collect, but that's how it's on the books.
So it's on the book. So maybe it gets collected eventually, but it doesn't come in. So that's quite a big percentage then. That's a big.
Yeah. So yes, this affects almost everyone. No physician practice or health system is immune to this issue. It's an issue systemic.
It's pervasive. It's a
Yeah.
systemic problem. And when
Yes.
you were responsible for the practice that we talked about, that was part of your issue. You were responsible for handling the debt and what happened to it. Is that right?
Yes, and it's kind of alluded to how I said earlier. Our operational expenses increase yearly, and then our what we were collecting was decreasing yearly. So it's not as for many institutions or even especially small practices, but even all the way up to large institutions, it's not a sustainable model when you have that much of a gap.
So I've just moved the slide to one of the options that hospitals. Tom, I want you to just because I'm going to ask you a question about this. One of the options that hospitals have, and that's I think what so many medical, especially smaller medical practices, but even larger medical practices do when they have debt, is they turn to their employees to collect on that debt. And you'll see from looking at the slide that there are certain advantages. For example, when employers collect on their own debt. The federal and most state collection regulations don't apply to in-house collectors when they collect on their own name. And they certainly can exercise oversight, and they have their existing systems to ensure HIPAA, but there are disadvantages. And I recall, Tom, that you said that you initially, when you were seeking to collect on the debt, you used in-house, you used employees, and I suppose these are employees that you trained to collect debt. Can you give us a little color there?
Yeah, well, our natural decision was to use our in-house billing. So these were employees that just focused on medical billing. So that would be to the insurance companies, to Medicare, Medicaid, and to the patients. But as I said, the debt would just accrue, and it just became so large that we would have to throw more staff at working these accounts, calling up
So
the patient.
Tom, I'm just going to jump in for a second. So you had billing folks, and these are the people who, right, who they're sending out the bills, but now they're calling to follow up the bills as well. And then you had more debt. So did you hire more people who are specialized in billing? What as more debt came on, would you hire more people, or did they just cover less of the debt? What was your
Um, well,
situation?
well, we were left with the choice of, do we hire more people and just kind of throw money at the problem? And the only reason I say throwing money at the problem is because medical billers aren't debt experts.
Right.
They are not collectors. They're medical billers. They know coding and procedures for submitting claims and educating claims. So we weren't seeing great success, in-house.
Right. So if we look at the disadvantages of using your employees, that they're not experts, right? They're not experts in collecting. And you have to hire them. They become, they're a full FTE. They come on your payroll, and it's not scalable because the debt can go up and down, mostly up. But and then you don't have the debt collection infrastructure that professionals have, and so you have them, but they're not as effective, right? That's really the issue.
That is
Were
correct. And
there?
then we found them
Yes.
spending, a good amount of time trying to collect debt. And by doing so, that takes them away from their normal scope of work, which is actually processing claims that happen every day. So if we're seeing hundreds of patients a day, but I have my staff allocated to working some old debt with very little success, the current work gets piled up, gets delayed, and that actually is a bigger hiccup to the system, because that's a delay in actually having revenue come right back to
Revenue
us.
flowing in.
Yep.
So the second option, so we talk about, the options for hospitals and medical systems. They can use their own employees, or they can move to third-party debt collectors. And from the slide, you can see there are certain advantages and certain disadvantages. Tom, you work with a third-party debt collector, and they get a percentage of what they collect. I mean, you pay them on a contingency basis, so they get paid based on how much they bring in. And can you just offer some thoughts about that, please?
Yes, after a little bit of over a year looking at the mounting debt and just looking at the numbers here, where we're carrying anywhere from 3 to 6% of our total revenue was in debt that we were struggling to collect, and it wasn't sustainable for our practice, that we actually had to engage a third party debt collector. And exactly as you stated, it was a rev share model. They got paid based on their successes. We did see a significant amount of success, but that was, and I attribute that to, this is what they do. This is, they are the experts. I will admit, though, we were a little gun shy, and so for maybe a few years, because I wish we would have done it earlier based on the potential success or the successes we saw. But it's a very touchy area where with physicians, they're worried about, they have their reputation. They're at risk for sending someone to collections. They're worried about the patient provider confidentiality, which is under HIPAA. So there were,
So there were those concerns, but it sounds like, if I recall, that you were able to assuage those, allay those fears, and you were able to address those with the debt collectors that you worked with.
That is correct, and we had to do it, like I said, because it wasn't sustainable losing, having a few $1 million out there.
Out the door. And then the third option is for hospitals actually and health systems to sell their debt to third-party purchasers. The advantage is of that is that the health systems get their payment up front. They don't have to wait for the collection to take place, right? And they don't need the employees and the salaries that they use from working with having their employees collect. There's no scalable issue, and the idea is that the debt buyer is a professional in the debt collection business. They work with debt collectors who are professionals, and the disadvantages, the same as before, you don't have the direct oversight, and you don't have control over which debt collectors contact your patients. Although we will talk about that as well. Tom, tell me, you did not, when you were with your health system, you did not sell debt to third-party purchasers.
That is
right?
correct. That is correct.
And I recall, I think you had said that it just wasn't something that you even knew about to do, or
Correct.
had thought
Yes.
about, or it wasn't even on your radar.
Exactly. Right. Yeah. As an administrator and our physicians, it's outside of our wheelhouse. As we, we like to think we have enough knowledge to cover, all aspects. It wasn't even thought of, outside, out of mind.
And frankly, Tom, if you went online, you would find very little about how hospitals and health systems can sell debt. It really, most of the literature is all about using debt collectors and not about selling debt. So we'll be talking a little bit more about that, about using debt collection and health and how to sell debt, but doing it in a safe way that allows hospital systems to engage in ongoing due diligence and control, frankly. So the next option is that the hospitals and health systems, they decide maybe they try to collect internally, maybe they try to use a debt collector, but in the end they write off their debt, and then they remove all the risk that may be associated with debt collectors, but then they lose value. So let's just pivot here. And just start talking about what it means to work with debt collectors, whether you're hiring the debt collector or whether you sell the debt and the debt buyer works the debt collector, because debt collection laws apply to all kinds of debt, including medical practices, and so there's federal, there's federal law, and as I mentioned earlier, the federal law generally applies only to third-party collectors, but a medical practice actually will fall under the umbrella, under the rubric of the federal regulations, if they use a name other than their own. So if they put out a message or a letter or an email that says debt collector or collection service, and they don't use the name of their practice, now they have unwittingly fallen under the regulations, the federal regulations, and many of the state regulators. But the basic, just so that our medical providers have an idea, the basic points of the regulations is really that patients, the consumer, shouldn't be harassed. So now, as to language or time and place, under the federal, under the FDCPA, the Fair Debt Collection Practices Act, collectors can't call in the evening. They can't contact folks and ask, like the employer's office. They don't speak to the patient's friends, family about the debt. And frankly, the state laws provide, in some cases, even more protections than that. But these laws were enacted so that consumers would not be harassed. And so for a debt collector to engage in certain behaviors, calling constantly, calling at the wrong time, calling at the wrong place, that would be considered an unlawful activity, and a consumer could bring a lawsuit. But when you're talking about medical debt, now you're thinking about HIPAA's privacy rule. And under that rule, covered entities have to limit the disclosure of protected health information, right? To the minimum amount necessary to accomplish the stated objective. And here the stated objective would be the collection of debt. So it gets kind of tricky, because you might say to yourself, well, how do I hire debt collectors, or how do I sell the debt without running afoul of this of HIPAA and the privacy rule? And it's tricky, but here are some details. So if a health system wanted to work with a debt buyer or a debt collector, then those debt buyers and debt collectors would become business associates under HIPAA. They'd sign an agreement. And then the covered entities would provide just a limited amount of information so that the debt collectors could collect on those medical bills, right? And just some additional information that if a debt collector is somehow provided more information, more protected health information, that's considered a breach, and there are significant penalties. So again, these are reasons why you want to know what the rules are, and you want to work with professionals. Tom, when you were working with debt collectors, I imagine you signed up a business associate agreement with that debt collector.
That is correct.
And I imagine that the agreement sort of laid out what they would be provided, what they could and could not do to ensure that they were in compliance with HIPAA.
Yes, they had to show their HIPAA compliance policy. Right.
And the reason for that is because you, as the health system, you're accountable, right? You're just as, even though you may be working with a business associate, it's your obligation to ensure that whoever you work with is following the rules, and if there's a breach, they notify you, and they take as seriously this responsibility as seriously as you did.
That's correct. As providers, we have the greatest reputation risk, in this whole process.
So, so if you see this next slide, it really talks about, what's needed, and the most important thing to know is that, let's say there's a dispute, and a patient or consumer who's being called by a debt collector believes that the amount being collected is not correct, and they have to give permission for that debt collector to receive the details of the underlying treatments. The collector is not entitled to that. So they might, the patient would certainly tell the collector that the amount is disputed. They may also go to the hospital and say this amount is disputed. And they have the right, the patient has the right to obtain the details of their treatment in order to further dispute the bill with the collection. So if a debt collection company obtains that, if the details, there could be a breach there under HIPAA. Just moving on. So what kind of information can be disclosed? Well, it's pretty minimal. The patient's name, the address, the social security number, birth, account number, balance due, the payment history, and the name and address of the healthcare facility. Not a whole lot. So that makes it difficult for a debt collector, right, to call and collect on the amount owing to the patient. So there are specific states that have there's been an effort to enact a national medical debt bill, but that has not been successful, and we may see it in the future. But right now, the states are passing their own laws, and we'll look at some of them. Many of them have to do with what may or may not be reported to a credit reporting agency, or how much interest may be added to a medical debt, or how much time must pass before a hospital can report adverse information. So it's pretty much piecemeal, but there are new ones that are popping up. Really, if you do searches, you'll see that there are more and more from different states. And certainly during this COVID-19 pandemic, there are various states that are taking action to curtail collections. Some pertain to medical debt, some don't. They're all different. So that's definitely worth looking into. Another a medical debt lawsuit ended with a 2015 settlement with 31 attorneys general that require the credit bureaus to wait 180 days before reporting on medical debt. So the question, so you have compliance, you have your options. So the hospitals and medical systems, they can collect themselves, they can work with debt collectors, they can sell their debt, they can write off the debt. There's a whole sort of interplay of federal regulations, debt collection regulations, state debt collection, and there's specific medical rules and regulations. There are orders. So it's a whole tapestry of rules and regulations to protect consumers and patients. So then what are some of the obstacles? What are some of the problems that I guess that keep people up at night when they're thinking about working with debt collectors and selling debt to debt buyers? Well, there could be a debt collector receives protected health information in violation of HIPAA, or you could have a security breach, or you could have a debt collector who's overly aggressive, more than you certainly want, or unlawfully collecting debt. There's potential for fraudulent activity, so that a hospital system may decide that to protect the interests of their patients, they may select one debt collector that they've vetted, and they may say, or one debt buyer, and they've said in their contract and in their business associate agreement that I'm selling you this debt, but you may not resell it. And if there are any disputes, you contact me and we will resolve it. And perhaps, and you write that into the agreement with the best interest, but then the debt is sold, and there's really, it's very difficult to enforce those types of provisions. So you have those types of problems. And here are additional examples of violations that could transpire. And maybe, Tom, maybe you'd like to comment on some of these alleged violations, and what you did with the debt and why, and what your thoughts are here.
I mean, I'll self-admit that I was naive to the whole debt collection process. So, like in your last three points, those were all fears that we had, that there'd be fraudulent activity. How were things going to be done? Our reputation's at risk. But again, I'll keep reverting back to the same thing. But for us to be sustainable, we had to, collect as much money as we can, because we had operational expenses.
Right. And so, and actually you're fairly new to the company Transparency Registry. This is a company that has created a registry for consumer debt, for medical debt, and it provides a way for creditors, for hospitals, for medical systems to keep track of their debt as it's collected, as patients make payments. And what happens is with this registry, if a hospital wants to use a debt collector, they want to sell the debt, they upload the debt onto the registry. It can only be seen by the details about treatment can only be seen by the patient and the hospital system. The debt collector sees the details they're entitled to see. The debt buyer sees the details they're entitled to see. And it provides a transparent way of keeping track of who owns the debt. And the debt collectors must be on the system, are vetted, so they're legitimate organizations. Tom, I was you joined the company, I think, more out of based on your experience, because you believed in what the company was trying to do to help hospitals and medical practices. Maybe you could speak to that about your experience and then how the registry works.
Well, no, as I was, presented the registry, I saw the importance and the huge value in applying this registry into distressed medical debt. For one, for the protection or safeguards that are put in place through the registry, most importantly for the patient, but secondly for the providers and healthcare systems that I personally know intimately, that are struggling to survive in this day and age with the landscape change in the insurance coverages and different plans that are out there.
Right. So if you're looking at the slide, you'll see that a medical office would upload the debt and documentation onto the registry platform. And this is the documentation that exists at the time that the debt is written off. And one of the issues that happens often is that from time to time, when debt is sold, sometimes the documentation doesn't move with the debt, or it gets changed or altered or lost. And then debt can be bought or sold, and or it can be sold in an unauthorized way without permission from the hospital system. So what happens here? You have the debt is uploaded to the system, and it stays there in that registry. And so as a debt collector is authorized, that information is added to the platform and added to the registry. And then as the debt balance changes, that information is added to the debt registry, and patients as well can securely log in. So if a patient is contacted by a debt collector who is not authorized, or if there's a debt collector who's engaging in abusive behavior, the collector, the patient can send up a flare. They can send a notification that I've been contacted by an unauthorized debt collector, that somebody has my information who doesn't have authorization, and that notification will go to the hospital system, the debt buyer, the debt collector. It becomes an early warning system for everybody in the ecosystem, in the medical debt ecosystem that's involved with this medical debt. So you don't have unauthorized use or unlawful behavior that's going unchecked. And what would happen is that the health system at the time of the sale would notify the patient, hey, I just want you to know in a communication that we have registered your debt. You can see it here. You will be contacted by a debt collector. Make sure that the authorized debt collector is you can see who that is in your from going onto your secure portal. So it provides all sorts of checks and balances that just do not exist right now. And we think it solves the problem, because only licensed, legitimate organizations can register and participate in the platform. The medical practices can track who owns and who's authorized to collect the debt. The confidential patient information is secure. And then the medical practice, if they want to sell the debt, they can collect that and capture that value up front, or they can work with the debt collectors. But again, they can see, and the patients know who is the authorized debt collector, because there's just only so much that can be done, and there are bad folks out there. And I know you said that sorry about this slideshow, that you had, you were concerned about these risks, but when all the documents are on the platform and patients can see securely, then those concerns can be allayed.
Exactly. Yeah. Patient safeguards is probably the most important and pressing within the healthcare organizations and community. And this transparency registry, by being so transparent and having the safeguards in place, I think allows us as providers or medical practices the comfort of knowing that the debt that's out there is protected. There's the safeguards are in place. So
Well, that's great. So, one of the things that we think about is the way that the patients can really take care of themselves and be in a stronger position. When I've reviewed litigation brought against whether it's debt collectors or creditors in these types of cases, what I see time and time again is that the patients did not have the details. They did not have the documentation underlying their care. And this type of this kind of program, this kind of platform helps them, gives them the documentation, gives them the details, so that if they're called, they know, or not if they're called, when they're contacted by a debt collector, or if they're contacted by a debt collector, they have everything they need, and they know who is the authorized party. Of course, patients, when they get bills, when they're billed, if they see a problem early on, they should certainly contact their doctors and health systems. But as you said, many of these hospitals and health systems are, they're just struggling to get the bills out. And if they're able to make a few calls to patients, I mean, that's a good thing, and it's rare, but they're really just trying to get those bills out and get the bills paid. And so if you have a platform where patients can see everything and send up a notification if there's a problem, that provides all parties involved of the issues. Catherine, how are we doing for time?
Excuse me, we're doing very well. Thank you. That was a great presentation. We do have time for a few questions, and I was wondering if you wouldn't mind answering just a few.
Sure, absolutely.
Okay, great. So I was wondering about fraud. How can healthcare facilities be sure that if they sell their debt, that their patients won't become victims of fraud? I know you went over a little bit of that, but I didn't know if you would mind going over that briefly.
Sure. Well, I'll start, and I'm going to ask Tom, since he has some hands-on experience as well. It's really important to, if you're going to work with, there are two parts to it, I would say. Is one is to vet the debt collector or the debt buyer that they're going to be working with, and get references, and all debt collectors are not alike. Some are more aggressive, some are less aggressive. Of course, it also depends on how much they're paying. How much are they paying? How much are they paying the debt collector, and the margins, and how much is the debt buyer paying for the debt? So they need to vet these debt collectors and debt buyers very well. And there are many legitimate debt collectors and debt buyers out there, so they just have to do their due diligence, just like anything else. But even in solid organizations, you can have bad actors, and that's why it's important to keep track of the debt, and make sure your patients know who the authorized debt collector is, so that if they're contacted by someone other than that, they won't become victims, and that they have the information of the underlying details, so they know exactly how much is owed. Tom, do you have anything to add there?
Yeah, I mean, not too much, because I mean, you're more of the expert when it comes to fraud and what have you. But it's like anything. There's always going to be risk. There's nothing that's ever going to be 100% risk free. But it's kind of like what's going on right now in this day and age, where we're trying to mitigate risk by social distancing. So any safeguards you can put in place can lower the risk, and that's what I'm seeing. Transparency Registry, this platform is providing. Like you just touched on, how the companies, whether they're debt buyers or debt collectors, they're being fully vetted through a process through Transparency Registry. So you are bringing what is the most vetted companies to the table. So
high quality
yeah,
organizations.
yes, with
And and they're professionals. I mean, these are professionals. They have the analytics. They have the technology. They know the regulations. So they will, they will do their very best to bring in, to get paid with, within the legal framework that exists. And this legal framework is, like I said, it's complicated and it's a patchwork and it's always changing. And so, there's questions, and they will use the most effective means to bring in the revenue as well. So they're doing all kinds of analytics and using artificial intelligence and predictive analytics, so that they don't waste their time calling folks who aren't going to pay. They're calling the people who are most likely to pay. They're using the most effective means, and frankly, mere lay people who are not specialists, it's very hard to compete with that.
Okay, how about this? Could you go over the options to healthcare providers that they have when it comes to collecting medical debt again, and what are the advantages or disadvantages for each of these options?
Well, what we were saying, Catherine, is that hospital systems, medical systems, they can always use their own employees, but and I think that's what most people feel most comfortable with, using their employees, because they don't want strangers calling their patients, right? They want to maintain that relationship. But again, your employees probably have have other responsibilities that they need to do, and as credit and as the debt grows, the last thing you want to do is heap on more expense to bring in debt that maybe you're going to bring in 10% or 5%, or whatever it is. So they can use their own employees, they can work with professional debt collectors, they can sell their debt. And the advantage of selling the debt is that they get paid up front. They know how much they're getting up front, and they don't have to wait for the collection to take place, whether it's 5 months, 6 months, 7 months, a year. And after a while, the debt becomes stale, and it becomes even harder to collect on that debt. So you've got professional debt collectors. You can sell your debt, or they write off the debt, and then that's just a loss. But listen, some hospitals, some medical systems, they want to do that, especially after some period of time. They don't want to carry it on the books, and they just stop, decide they're going to stop collecting.
Okay, and what things should a healthcare provider know about capturing value from their medical debt so it doesn't become a total loss?
Tom, do you want to take that one?
Well, I think the value is knowing that we have an alternative to collecting some revenue versus historically collecting zero revenue.
And especially now, when there's so much medical debt and so much more coming. I mean, when we see it's almost if you look at the credit reporting agencies and you see who is reporting, you'll see that right now there's very little infrastructure for collecting on medical debt. There has not emerged a specific provider for buying medical debt, for collecting on medical debt. It is not in the hands of the few. It is not an organized, well-organized infrastructure for collections on medical debt. That's why so many folks really, they don't have a plan. They don't have a process. And it's tricky. And that's why we, like I said, that's why we created this platform, because hospital debt, medical debt is so different from every other debt. They want to, medical facilities want to ensure that their patients are healthy, are cared for. They don't want to undermine that. They don't want to take it apart. And so medical systems have to find the right process, the right partners to ensure that their patients are not abused in the process of getting, of paying out what they owe to practitioners, to hospitals.
Okay, well, thank you so much, Andrea and Thomas. Do you have any other words of advice or anything that you would like to leave with us today?
I would just say, anyone on the call, anyone on this this podcast, this webinar, can call me, send me an email, and we want to be helpful here. So please feel free to reach out.
Yeah, and I share the exact same sentiments, and I appreciate the invite and being a part of this webinar today.
Great. Well, thank you so much. We appreciate you coming on as well, and it's been a very informative and eye-opening webinar. So we really appreciate that and encourage our listeners and attendees to reach out to you both. So attendees, you have the contact information there. If you need to, don't forget that you can download a copy of the slides. And then if you need to, you can reach us, and then we will put you in contact with Tom and Andrea. And you can send us questions as well, and we'll forward them on. Please remember your PAYCOM and your PMI CEU certificate will be emailed to you from within 2 days following the broadcast. There's no need to request it. It will be sent automatically. You can register for any future webinars or request a demo of our compliance solution on our website at firsthcc.com or call us at 888-543-4778. And thank you for joining us.